Good evening, everyone. I'm AnnMarie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to talk about how to avoid heart attack and stroke altogether and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to 760 WJR. So welcome, everybody. We're back on Facebook again to all of our loyal Facebook listeners out there and watchers. So, Dr. Kolender, what's the news of the week?
Well, now I'm multitasking, so we're talking on the show, and I'm commenting on the Facebook feed. So we can take calls off of Facebook, which would be great, and look forward to having a good conversation today about a patient who really covers a lot of different boxes are checked, and it's a very interesting person.
It's a new patient?
No, someone I've had for a long time.
And what's changed?
Nothing. Not everybody that is in the office is compliant. They don't all listen to everything I say all the time. And because we're able to follow the data that measures their risk, I don't say I don't worry about it, but we know where they are. And so we can manage them as they go. And I know what his risk is. And so as long as he, comes in, we can refocus and manage all of his disease processes that contribute to heart disease. And I don't worry about it too much. There's no surprises to me.
Mm-hmm. So you're just able to stay on top of it and let the patient know where he stands, whether they're compliant or not. At least they know.
Well, they've, hopefully, when they get a hands-on with me, it's a kind of reintroduction of the process and get them a little more motivated. So, and then we have to try to schedule some more follow-ups because my patients really are just like anybody else.
Well, except they figured out how to get to you. Again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we're here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, welcome back. Your show is always very interesting. What's the news of the week?
Well, first is we want to remind listeners that have high blood pressure or partially treated blood pressure that they could go to kolendermd.com and put their name into our website there and possibly contribute to a research study where we are studying some, I want to call it experimental water, that is, advanced hydration. So we are studying some water products that have anecdotally been shown to reduce blood pressure and heal cramps or stop leg cramps from happening. So we're going to do an actual study on this product and see if it's real, because if it is, it would be phenomenal. And there's actual data supporting why that may happen, meaning electrolyte manipulation can reduce blood pressure as well as treat cramps. And it's really about delivering the electrolytes to the cells where they need to be with the greatest efficiency. So maybe there's something about this product that does those things. So if you're a listener and you're hearing this, you can go to kolendermd.com, sign up, and we'll be getting to you in the next few weeks while we get the study together and screen you to see if you're a candidate.
It's actually pretty amazing, because if this does follow through the way you want it to follow through, it's great news for people that are stuck with medication for the rest of their lives.
Well, it's not a matter of what I want. It's just what is going to happen. So I don't have a vested interest in this other than to say, I think it's kind of cool that the manufacturer came to me for my opinion, and can we, and I offered to do something about it, and they're thrilled that we can do a study. So we'll call some people from the radio show, we'll pull some people from the practice, and just formulate a study and possibly publish it.
Mm-hmm. That's pretty radical, though, when you think about it, because again, you're going up against pharma in a way, and nobody wants to be stuck with having to take medication for the rest of their lives if this works out the way you want it to work out.
Well, I think it's important to just do an actual study. And granted, we're not going to really have a control group. Well, maybe we can have a control group.
Mm-hmm.
And it'll be a small study. It'll be short because we don't have any funding. And like I said on the show last week, for people that do participate in the study, who get chosen to participate in the study, we'll reward you or thank you by doing a CIMT for free. And again, just because you call and put your name on the list, if you're not chosen for the study, we won't be able to do that. But if you participate and you follow through with all the things that we need you to do, then it's the least we can do is do a CIMT and give you some guidance on where your risk is.
Yeah, and that's pretty important as well. And let's hope that the people that do call in are people that haven't already taken advantage of the CIMT. So it'll be a great bonus for them to get on board with what that study shows you, what that equipment shows you.
Well, we know who you are.
Yeah, right.
So we already know who those people are. But anyway, you got to fit the criteria. You have to have cramping, and you have to have some degree of elevated blood pressure.
So it has to be both. It has to
No,
be.
it can be. We'll have different groups. We'll probably have a small group that has blood pressure, a small group that has cramping, and then we'll study them. And how many we have really depends on. We do have a sponsor, which is the product supplier. So if it's just how many people they're willing to give us product for, because we're going to have people take so many drinks a day, we got to watch them drinking it. Obviously not in person, but they've got to record themselves drinking it on a virtual visit, and just to make sure there's compliance.
And how long does the study last? How long are people going to be involved, volunteers?
7 to 10 days.
That's not bad.
No, because the anecdotal stories are that the blood pressure goes down in a week, which is fast. I don't expect a blood pressure pill to work that quickly.
No.
So we'll see. That's the stories we're hearing. So let's quantify it.
Yeah, that's pretty amazing. And it's unbelievable that something as simple as a drink and controlling electrolyte balance could make a huge difference in your blood pressure and your health.
Well, it's a unique product, and I'm not sure it's something that can be easily copied. So if you're hearing this and you're hearing that electrolytes lower your blood pressure, I'm not saying to go and buy your powdered electrolytes that you mix to a bottle of water, and that's okay, because this has a specific mix, a specific blend. The water's been engineered a certain way, and it's absolutely pure. So I would not extrapolate that to whatever you think you're going to do at home, because I would say the opposite would probably happen at home. Your blood pressure will probably go up because it's a bad electrolyte mix, what you're getting over the counter.
So you're encouraging listeners not to go off and do their own studies.
Absolutely
based
not.
on what they're hearing on the radio. Well, let's hope it all works out very well for the good of mankind and the people that are suffering from high blood pressure. Right now, we've got to take a short break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. And
we do have a question on Facebook, so we can bring that up afterward.
did you know you got
I didn't get a call.
Oh, well, it's on the chat.
It's on the
Yeah,
comments.
I'm multitasking.
Okay, so
So
what's the question?
Well, I mean, it's Gary from Shelby.
Oh, okay.
So we'll put Gary on when we come back on. Not
Okay.
on, but I'll read the question.
Yeah.
Yeah, so next I think we'll get into stuff about patients and some stories and things that hopefully patients or people, the listeners, can relate to, and motivate listeners to go and learn more about their health, more than what they're learning from their usual PCP.
Well, they're not learning anything from their
Right.
usual
No, that's
PCP,
true.
so whatever information they get. So what are you going to give us some special stories of patients that you saw recently?
Of course.
That's good.
Just got to wait a little bit.
Who
Well,
are,
we'll talk on the air.
yeah, no, we're going to, right, exactly. But I just want to know the lay of what we're going to be doing when we come back. But that is kind of a blockbuster, to stop and think about something that's relatively simple. If it works out and if it turns out to be, actual that it works, that's pretty amazing.
Well, there are a lot of holistic remedies that can have a positive impact on your longevity and artery health. They're just not well studied. And, I mean, in my practice, I've not seen holistic remedies heal arteries. I mean, not reliably enough. We do have to use a lot of traditional treatment. So I don't want to say, but there's a lot of one-off studies that pomegranates does this
Right.
and this vegetable does that. And so, it's, I think that's part of it, meaning lifestyle is a major tool for prevention. It's, it's the most important tool. So that's food. We just got to give people the right foods to eat, and then you still need to watch them and measure the data points that matter and make sure that what they're doing is good enough, because you cannot assume that
Right.
something's good enough or not.
Yeah, well, it's certainly great news for people that are struggling for a lifetime with high blood pressure if this works, if it gives them another solution. But there are a lot of people that take home remedies and think if they buy these supplements and they go out and they try to treat themselves, and not necessarily guaranteed that works.
Right. We can go to the caller first if you want.
Okay, but this is not a caller. That's a
Yeah,
Facebook
yeah.
question, right?
Okay, yep.
Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many chronic conditions, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we're now available to arrest and reverse the progress of these silent killers. We're inviting you to call in at 800-859-0957. Again, 800-859-0957. Dr. Kolender, over the break on Facebook, you have a question from one of our Facebook followers?
Yeah, we have James from Shelby reached out on Facebook to say, Dr. K, does a stethoscope to the carotid artery give any indication of stroke possibilities? So, that's a good question. And, we're all trained to listen for a noise called a bruit, which is a sound that an artery makes if there's turbulent flow inside the artery. And unfortunately, there's studies that show that doctors really can't hear, these noises well, and that they don't always translate to disease. And I know that I've listened to some people and could swear up and down that they've got a bad artery, and I'm listening to a stenosed artery, and then we go get their carotid imaging, and they don't have anything. So it is important to do our exam, but when it comes to prevention, I think having the data that we collect matters the most. a really good look into the carotid wall, which we do with our carotid intima media thickness test. And that gives us a few pieces of information. Number one, it tells us about plaque, whether you have it or not. It tells us about the layer of the plaque, the layer of your artery wall where plaque activity occurs. And that data point correlates directly to risk. And it also tells us about the quality of the plaque. So there's a concept called lipid-rich plaque, is how much is the lipid content or the quality of the lipid content inside that artery wall where the plaque is. And the softer the plaque, the more dangerous. So back in the day, you used to hear, heart disease was hardening of the arteries. And now I think of hardening as a good thing, because if your arteries have hardened, that means they've healed. They've healed and formed calcium deposits. So calcium deposits inside your artery is not a bad thing. It means you're able to heal, and you may be forming stable plaque. So you still need to go through all the due diligence and take these measurements and get your inflammation blood work that we talk about. Identify all your drivers of disease, which we're going to talk about in detail soon, a little later in the show or now, and stop the plaque, stop the development even of stable plaque. So getting the data is important. I think that doing a well exam is not that helpful. I hate to say it. We need the labs and the imaging that measures risk that we can quantify. And you just can't trust that your doctor listened and heard or didn't hear anything, and then you're okay. And it's not the doctor's fault. It's just no one can do that. No one can listen and say no problem at all. They've got to measure those data points within your artery.
Which comes back to the message that you deliver all the time, is the importance of the CIMT test. And for those listeners who have had the CT cardiac calcium scoring test and think that they're home free because they got a number some time ago, because that was one of the first tests to come out and be known. But what you're saying is the CIMT is much more valuable.
It's one of the tools that you need. It is the most important tool to me. But even my patients that have, and this is a good segue to talk about this one particular person. Even if the patients that do not have any plaque on their CIMT, I send them for a calcium score. Like, I don't do it the other way around. We tell our listeners to go get a calcium score, a CAT scan calcium score, because it's readily available. But in my office, we do the CIMT, and then for the negatives, we do the calcium score.
Well, let's come back. We've got a couple of callers here. Katharina, who's calling?
Yes, we've got Siobhan, our co-host, actually, from Germany. Thank you for joining us, Siobhan. What's your question?
Hi, everyone. Glad to be tuning in. Sorry I can't be on the show, but I was interested in, you were talking about the study you're doing in the first segment, and I'm interested to hear a little bit more about, I guess, the correlation between hydration and blood pressure, because it sounds to me like maybe poor hydration could lead to high blood pressure. Is that true?
Well, it's more about the electrolytes. So there's some studies that show that people who run high normal potassium levels can have lower blood pressures. So it's more about what the electrolytes are in this hydration product and how it's delivered to the cells, and that the electrolytes get to the parts of the cell that they need to get to. So we don't have a mechanism of action yet on what is happening, if anything at all, because again, we have to do the study. But there's a theory that the way this water is engineered, the way the electrolytes are balanced against amino acids inside the drink, allow the electrolytes to get, potassium's an intracellular electrolyte, meaning there's most of potassium's in cells. It gets into the cells, and the other electrolytes that are there don't hurt you. And they also help with improving cramping. So yeah, I don't know that it's about the water. It's really about, well, it is, in that the way it's engineered and the specific electrolytes that are there and the way they've balanced it, by pH and by the osmotic forces of the water with specific amino acids. So I think that's what it's really about.
Interesting information, Siobhan. Thank you for calling, and good luck with the remainder of your tour of Europe with Star
Thanks for calling. Good luck.
And we'll see you when you come back to co-host the
thank
show.
you.
All right, be well.
Great.
All right,
great
we have
show.
another caller.
Yeah, we do.
Katrina?
We've got David from Windsor. Appreciate you joining us today, David. What's your question?
Yes, my question for Dr. Kolender is this. Many doctors in the healthcare system have no awareness or no knowledge about nutrition. And when it comes down to nutrition, wouldn't it be wise to go to a doctor that doesn't just specify in or specialize in conventional medicine, but also about nutrition and exercise? What can you suggest about that?
Well, thanks for calling, David. It's about, sometimes it's about time. And, this is why it's important to see a doctor who's removed themselves from the system, which is based on volume medicine, so that they have time to talk to you. And so that's why it's really important to see a concierge type doctor who's chosen to see fewer patients so they have better quality time. So having that type of model, your doctor in that system, gives the doctor a chance to have these conversations, because when you're in a population-based practice, which all of you are, you're in your doctor has 5 minutes, and even a doctor with a great reputation, all they have time to do is either write a prescription or refer you to somebody else. And then they're out of your office, and there's no follow-up on that anyway. So it's important that your primary caregiver be your health coach, and you've all got to listen and choose to put yourself in that situation so that happens. So that's really the most important thing, is find a doctor who's chosen to give you the time you need and then provide those services.
Yes, and we've talked before about the compartmentalization of medicine and how they do get lost in the system once they're referred out, because most PCPs don't, follow up on the patient once they've been referred out. Well, anyway, in the meantime, we're going to have to take a quick break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. Okay, back on Facebook again. That was a very good explanation, though. I thought you went into in depth about what the CIMT is about, because I still think people don't understand.
Thanks.
Well, okay. So do we have any more Facebook people that are?
No, nothing else on here. So we'll get into the patient next. So we're going to get into a patient who really, like we said, checks every box. And it's a great way to talk about all the details of what we do in someone who doesn't have plaque. That's really what's shocking to me, is this guy, he has everything and he does everything wrong. And he still doesn't have plaque.
Wow.
So it just means that even in people who don't have abnormal CIMTs and don't have zero calcium scores, you still have to identify their drivers of disease, because you can't assume they're okay even then.
Why not? They have no
Because they're
plaque.
not.
They have no plaque on
they still
either
have
test.
They still have conditions that can cause plaque, and some I'm observing sleep issues, sleep apnea, oral health.
Even although you're not seeing anything on the test, when you're doing the CT cardiac calcium scoring test or the CIMT, and you're getting nothing.
And he has everything else.
Wow.
So this is a great time to talk about all the drivers of disease, genetic and likewise. Yeah, let's go to the caller when we start.
Yeah, okay, that's fine. So interesting. But the things that people don't know, they walk away. So many people have gone and got the CT cardiac calcium scoring test, and they walk away and say, I'm good.
Well,
I had under
let's come
100.
at it from that angle, because he has a zero calcium score.
Yeah. What about the caller that called it at 2,500?
Well,
And his doctor said we'll keep an eye on it.
yeah.
Yeah.
So yeah, so this guy's a 0 score. He's a normal CIMT, and everything in the world is poised to blow up.
Mm-hmm. Wow. So he can still have a heart attack?
No, but he could develop Alzheimer's or Parkinson's or cancer, and
So there's all kinds of other dangers.
and don't ask me what these other 50 diseases are. We can have Dr. Thompson on to talk about there's 50 diseases that can come from bad oral health. So
Sure. At least.
I don't know what they all are. So identifying that risk and managing it, you don't know what you're preventing on these people.
Mhm.
Because not knowing, the goal of prevention is nothing. There's no reward at the end.
Well, there is for the patient.
Right, but they don't know. No one knows the what if. And you've got to be happy that you're not going to know. You don't get that short-term satisfaction from a surgeon. Oh, you came in with this, I did my operation.
And you're done.
It's
That's
fixed.
it. That's
Everyone's
it.
happy.
That's
Let's have a beer.
compartmentalization of medicine. That's it.
Right. In prevention, if you do a good job, nothing happens.
You don't wind up in the hospital.
Right.
You don't wind
Nothing's
up going, I mean,
happened.
that's right.
And
That's good,
so
though.
it's the opposite of it's severely delayed gratification.
Yeah. Well, we've got one caller.
Yes. we've got-
So when we come back, we'll take the caller first, right?
Yep.
Sounds good. Welcome back to our special live medical broadcast on 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. Katharina, you have a caller?
Yes, we do. We've got Dan from Lexington. Hi, Dan. Thanks for joining us today. What's your question?
Yes, good evening, Dr. Kolender. Yes, I have a question. Do you have any recommendations for therapy or nutritional recommendations for aortic, it's very mild, but it's mild aortic root dilation, I believe they call it?
Yeah, well, thanks for calling. Is it Lexington, Michigan or Ontario?
Michigan.
All right, well, thanks, sir. You're our first Lexington, Michigan caller. So welcome. So when it comes to aortic root dilatation, there isn't a specific diet other than what I would tell patients to do in general for longevity. So most of the longevity data is recommending a Mediterranean diet. And again, not knowing anything else about you. So usually we'll make recommendations based on genetics, on how you metabolize food, what your lipids look like, family history. So we'll put all that together and make some kind of diet recommendation. Without having that information about you, I would go with try to have a Mediterranean diet, which is, fish, a lot of roasted vegetables, a little citrus, whole grains. You want to stay organic, and that's a generally good diet. Aortic root diseases can also cause AFib, so you want to make sure that you get a sleep study, because there's a correlation between that and AFib, and there's a genetic test you can get called a 4Q25, which identifies increased risk for aortic valve disease and AFib and heart disease and stroke. But another thing you got to do is just make sure that you're getting imaged twice a year. whether it's an ultrasound, an echocardiogram one time and a CAT scan another. Just want to make sure that you're catching that issue getting worse if it does, because there's a narrow window for getting it fixed, and you want to make sure that you catch that window. So those are all the things you got to do, and make sure your blood pressure is good. That's a big one.
Well, thank you for calling. But Dr. Kolender, I do want to ask you about this patient calling. Isn't his doctor responsible for ordering all these tests and telling him what he needs? And I'm assuming that he's got a cardiologist.
Well, unfortunately, most, again, this, when you talk about genetics, that they just don't have the time to do that. There's so much negligence occurring out here in the world. Meaning, when I mean the world, I'm going to say Metro Detroit, and I'm sure what's happening here is happening everywhere. And we've said this before, and we'll keep saying it. If you have a heart condition, you should be getting a sleep study. And I have patients who've been with, their cardiologist for 20 years. And, all of these things we talk about on the show and have been talking about for 3 years, this is an evolution of my practice. So it's not like I'm been recommending this for 10 years to my patients. As I learn, the practice adapts and we change. So some of my patients are not listening to the show, and they're hearing about getting a sleep study, and then they're resistant and maybe get it later. But the sad part is the cardiologist did not tell them to do this, nor ever did. So
why is that? I hate to interrupt, but why is that? Isn't it their responsibility? I mean,
I said it's negligence.
Yes, okay.
If you are a heart patient and you're not been advised by any of your doctors to get a sleep study, especially in arrhythmia, if you have an irregular heartbeat and you've not been told by any of your doctors to get a sleep study, it's negligent. And it doesn't mean it means you need a new doctor. I'm not saying go and call a lawyer. I'm just saying get a new doctor, because they're not on the ball. And I'm not calling out any specific cardiologist, but if you're a cardiologist who treats irregular heartbeats, and there's another process that can make your patient's irregular heartbeat better, which means you might lose them as a patient, well, you're not financially motivated to get that evaluated, because you're going to lose a patient. Their heart rate's going to get better. I can't tell how many patients of mine I've taken off blood pressure pills, their heart failure's gone away, they're off their water pills because we treated their sleep apnea.
That's pretty radical. That's an amazingly radical thing to say. It's a very simple test.
Yeah, well, it's a simple test.
People can do it at home now themselves. They don't need to go into a clinic.
We do a home sleep kit, and I don't want to say the treatment is easy, because it's not. But it doesn't mean that you can't. You still got to do it, and you still got to make it happen and make it work. And it's a full team effort. And you as a patient need to be your own advocate, because sleep medicine's I hate to say it, it's a disaster. Getting evaluated, getting tested, getting fitted, making it work, getting the device, getting follow-up, being monitored the right way, it's a disaster. No one's doing it right. And then you get diagnosed, and I'm not saying that everybody should, that there isn't some people aren't candidates for an oral appliance, because dentists can make a mouth guard.
A lot of them do, yes. Mm-hmm.
Well, the problem is, if you get diagnosed and you go to a doctor who treats one way of managing sleep apnea, they're going to sell you that thing, whether it's the right thing for you or not. Mm-hmm. And so it's the Wild West out there for sleep. So yes, it's getting a lot more attention. And even with the extra attention, your PCPs and your specialists are not connecting the dots. And plus, people don't want to get tested because they hear about the mask and they hear about this or that, and they don't want to know. You got to get the diagnosis, and you got to get screened. And I don't care what you think of your sleep, go get screened. It's not expensive to get screened.
And I should mention while you're talking about this right now and while we have time that you do have in your office, you have the test that you take home and do it from home so that they don't have to go into a clinic. And if any of you are interested or you can't find out where to get the sleep test, I'm urging you all to call Dr. Kolender at 248-642-1000. I mean, you've got them in your office, right?
I mean, it's included in the program that we offer.
Right.
I'm working on something. I haven't told AnnMarie yet, but we're working on something.
Yeah, you could have told me before, but let's...
Right. We're working on a sleep solution.
Right.
A global sleep solution. So it's in the process. I don't know it's going to happen, but we're trying. So when I say we're trying to make things happen for you people, we're trying.
Well, it's really important. I know we have another caller, but we'll
and I
probably
got
wait
no
till
skin in this game.
Yeah,
and I'm still trying.
Skin in the game.
We're still trying to offer a global sleep solution. So, all right, go ahead, Katharina.
Well, no, because we don't have time to take the call. We'll have to wait until after.
Sorry, wait for the next section.
We'll come back after the break and give the caller his or her due time. But very important, and you know, you talk about the sleep study all the time, and it's just something that everybody should get regardless.
Well, I tell all my patients, even the ones who say I sleep great, I go, fabulous, prove it, get this, do the sleep study. And if you don't have sleep apnea, beautiful, we'll check again in 10 years. And you do have to check periodically. How often is not known, but the incidence increases with age. So a negative sleep study 10 years ago means repeat it.
All right. Well, right now we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and you would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR.
I'm tired after that section.
That was good.
Thank you.
We're back on Facebook again. And no, but I mean, the thing is, you drive that and drive it and drive it all the time, and it's so important.
Right.
And you know, I just feel
we got
as
to talk
though
about the patient next. If we got the caller, then let's tell that story.
Yeah. Right. Well, the news is that we are now on the final. Well, no, we're on section 5 now.
Yeah.
Yeah, that is final. But I thought that was really informative. I mean, the way he explained it. Yeah. So, but I do think as far as a lot of, you know, with the sleep study, a lot of people still are afraid of going into sleep overnight in a clinic in a basement somewhere.
Well, yeah, well, no one wants it. When they hear about the treatment, they don't want the treatment. So they go, I don't want to get tested. But you got to get tested and then deal with the consequences, because talking about it in a theoretical sense is one thing. But when you learn you have it, it's another story, and you got to deal with it.
Right. Well, at least you know where you stand. I mean, people have nothing to lose.
Well, even then, I get a lot of resistance. I mean, I
get a lot of resistance from your patients to actually doing the take-home study.
And then moving on to the sleep doctor when they have a bad result. I mean, I've had some really bad numbers lately.
Wow.
And then the patients decide to get in a fight with a sleep doctor. You know, so they'll find any way not to get treated. And that includes getting into a verbal altercation with the doctor so they get kicked out of the practice. Like that's what I'm dealing with too. And these are people that are paying me to be in the practice.
Right.
And this is what they're doing and how strongly they don't want to treat their sleep apnea. But I don't let them off the hook.
Well, no, you're very persistent, but I think the main problem is that people do not want the CPAP machine. No, and some people have to get another one and another one.
Well, again, that's the crap of the system.
The crap of the system is they should build a better machine if they can send someone to the moon.
Well, it's the way the healthcare system is set up. Well, there's few choices. I mean, there's probably a lot of mask opportunities and different masks to try, except that, you know, when you go to your vendor, they only have 2 and you don't have access to all of them. And so it's all these little things that get in the way. you know, and also that the government only allows so many durable medical equipment vendors. So now you're dealing with the government limiting, you know, the licenses to sell these products. You've got to take over someone else's business to sell them yourself. I mean, there's so many barriers to therapy, and a lot of it is baked into the system. There's so many barriers to prevention that it's a challenge to get through it all. And so our way of getting through it is just pay cash. All right, we're going to skip it all. But at some point, you still have to deal with your insurance to get the services to fix your problem. It's still bad. The whole thing's rigged against convenience and choices and success.
So bottom line, you have a thankless job over there. All right.
Well, that's why I outsource sleep medicine.
Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Before we come back, Dr. Kolender, we do have a caller that's patiently waiting.
Yes,
Katrina?
we've got Ray from Brighton. Thanks for joining us today, Ray. What's your question?
Well, thank you for taking my call, Dr. Kolender, and my wife and I have been listening to you for some time. And my situation is I have AFib. Found out in 2019 that I had AFib. Had an ablation in September of 2021, but have continued to have reoccurring episodes, and they've gotten more frequent. I was scheduled to have another ablation last November, but then my wife we had found out she had breast cancer, so I canceled it to take care of her. Thankfully, she's doing fine now. But my instances of episodes have gotten more reoccurring and sometimes lasting 3 and 4 days. I've always been fit. I've been a trainer and an athlete all of my life. Never have smoked, don't drink, have always tried to eat right. And so my doctor, they put me on metapropyl and basically, there you go.
Well, Ray, thanks for calling. Has either your cardiologist or your electrophysiologist, which is a specialty that handles irregular heartbeats and does those ablations, have either of them recommended you get a sleep study?
Well, to his credit, the electrophysiologist did recommend it before my first, before my ablation. He didn't push it, so I didn't, dummy me. I didn't know how important they were, so I didn't do it. And he's never said another thing about it.
Well, he checked that box.
Listening to you, my wife, she's been pushing me to do it pretty. So I know I need to do that, but, and I'm not sure this is appropriate, but I've called your office and I really, really would like to be able to get an appointment with you. If that's ever in the works.
Go to colendermd.com and there's a link to sign up for the practice, and I'll make sure someone reaches out to you tomorrow, Ray.
I appreciate that. It's just very frustrating because, like I said, I've been fit all my life, and now, I was a kettlebell instructor, a karate instructor, right up until the time this all happened, and now I can barely do. If I jump in and do a set of push-ups, I go into AFib. I have to really take it easy. The triggers are.
Yeah, well, there's a lot of lessons here for the listeners, which is you cannot make an assumption. You cannot assume because you're active, you're an athlete, you're fit, that you're okay and those things are enough. You have no idea. You've got to get the data that measures your risk, and that's very important. So no assumptions. And a lot of people make them. And you just can't. And there's a whole variety of assumptions. There's, my parents did this, this one did that, and there's longevity, there's early death, it doesn't matter. You've got to go get the numbers and not assume just because you're a workout, weightlifting vegan that you're okay. There may be genetic issues that push you over the edge, and that does not mean that you cannot be managed. You just need to know what all of your risks are. So thanks for calling. GetColenderMD.com, and we'll talk soon.
All right. Thank you for calling. Good question. And, again, it comes down to you've got to get into the right practice.
Right.
And it's very, very important. And I think it's important for everybody to be in a concierge practice and getting into a practice that has a specialty of prevention. That's like a needle in a haystack.
It is. And I want to take the few minutes left in the show. We have 4 minutes of my time to talk. So I want to talk about a patient. So
okay, go ahead.
So we talk all the time about getting the CT calcium score. So I have a patient I saw today, 40-ish, early 40s, guy, and he does all the wrong things. He just quit smoking. He doesn't eat healthy. His home life is challenging. He doesn't work out. He's very stressed. He doesn't sleep well. And he has a 0 calcium score. And when he does his CIMT is perfectly normal. And so that's not the end of his story. So even though we talk about those data points being critical to measure your cardiovascular risk, we still look for all of the silent killers with him, meaning the silent killers are things that you live with for 2 decades before they become aware, before traditional medicine would diagnose you, and they cause chronic disease all along. So we want to find them as soon as we do. So this guy, he's got, he did quit smoking. He's got severe insulin resistance. He's nowhere near being diabetic. He's got normal blood sugars, a normal hemoglobin A1C, but he has off-the-chart insulin resistance, which means that's a source of inflammation that's going to do something to him down the road, whether it's going to be Alzheimer's, Parkinson's, heart disease later on, stroke later on, even though he doesn't have it now, cancer, other neurodegenerative diseases. All of those are associated with insulin resistance. And so identifying it and applying, an aggressive approach that early is important. And this is prevention. Find these things early. The other thing he just finally did a sleep study, and lo and behold, he's got sleep apnea. So he's now getting accustomed to his CPAP machine, and he wakes up every day exhausted. He's going to feel better. He's going to lose weight. His blood pressure will come down. Like, for instance, he came in today, his blood pressure was not ideal, and I didn't treat him because he's going to start his CPAP. That's going to lower his blood pressure, and it causes weight loss too, because when your sleep is better, your hormones are working better, and that your body works better, and you just metabolize food better, and you tend to lose weight. The other thing he has is periodontal disease. And I ask all my patients about the status of their dental appointments. How is it? And if they tell me they have, some gum issues and the dentist isn't happy, then we do a test. There's different vendors that do this test. The one we do is called oral DNA, and it looks at the bacteria in your mouth that is correlated to heart attack, stroke, and dementia. And frankly, there's about 50 diseases that are related to poor oral health and these specific bacteria. So we measure those, and this is another data point we can follow over time. Your pathogenic bacteria burden is a number that we can follow and follow our progress. So here's a guy, normal CT, normal CIMT, yet he's a mess. Mm-hmm. And he has uric acid elevations, another independent driver of heart disease. All this stuff, it's remarkable. And I told him today, I don't understand why you don't have heart disease. Mm-hmm. You have everything in the world that causes it, and you don't have it. But just because he doesn't have it doesn't mean we can't deal with it. We can't let him go. He's got to work on these things. Something else is going to happen that we don't predict.
All very important, and he's very lucky he's in your practice. So everybody should listen to the message that you're delivering tonight. But unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well. Fabulous.
Great show. One of your better ones.